Hey family, I'm uploading a interview with Dr. Altalla that was recorded on July 22nd. This is the second interview with Dr. Altalla. As you may have heard, this piece of shit regime bombed the tents right outside Al-Aqsa Hospital, killing, I believe, 5, possibly more, and injuring probably dozens more. This is insane when you think about it. When you just think about if that were to happen in the United States, where we were having a crisis and tents were being constructed outside of a hospital for patients just trying to get in the hospital because it's so crowded and it's the last hospital left, and then for that to be bombed by, say, Russia or China. So it's incredible, the hypocrisy here in the West and through our governments. Dr. Altalla has bravely been serving in Gaza and refuses to leave because he sees it as a duty to his people to serve until this genocide ends. So please show him your support. He's trying to raise money on a GoFundMe for his master's degree in the UK. It's what keeps his spirits alive, knowing that he has something to look forward to after this hell. It's very heartbreaking to hear his story and hear about the ones that he loved that are now lost to this genocide and this piece of shit regime, and our piece of shit regime supporting that piece of shit regime. So please go and check out the interview. Try to watch it all the way through. There was so many technical glitches that were happening throughout the interview because the internet is very spotty in Gaza. He cut out like at least 30 times throughout the interview. It took me hours to edit the footage, and it took me this long to release this episode because I had to wait for him to upload his local files that were better quality in audio, or else you wouldn't have been able to understand any of it. So we're releasing it now because now it's finally, viewable. So check it out and show Dr. Altalla your support, and watch it also to connect on a personal level with these doctors to understand what the staff goes through so you can fully digest it. Again, I love all of you guys who have been supportive throughout this movement and who have been emotionally connecting with the suffering in Gaza. It shows how human you are. Don't ever gaslight yourself into thinking that this compassion and these feelings of sadness and horror are misplaced. They're not misplaced. It just shows your humanity. Embrace it. We have to feel our way through life, or else there's no point in life. There's no point of being on this planet if you cannot feel the sufferings of other people around this planet. It's the whole reason you're here. So again, check out this interview, Dr. Altalla. It was recorded on the 22nd of July, and that's just horrifying to think about, that the staff at this hospital, in treating patients from other bombings and diseases, now have to treat patients who are bombed right outside the hospital. Think about that. Fully comprehend that. Like I said, I always say this is Nazi level. The same inhumanity that we saw during the Holocaust is at play right now, and we're funding it. So anyways, guys, love you. Thank you for supporting Palestine. Thank you for being there for Palestine, and keep it up. We have a long ways to go. It's just getting started, so just strap in for the long haul on this.
Morning, family. Welcome to Colonial Outcast. To get straight to the point, we are back with Dr. Altalla from Gaza. Most of us see image after image and video after video of the never-ending carnage wreaked by the terrorist state of Israel on Gazan civilians. After an airstrike, witnesses on the ground will post videos to show the shredded bodies and bloodied victims as other Gazans bravely dig their fellow humans out of the rubble. What we often don't see is what happens to the injured Gazans who are still alive and the medical staff who tend to those injured. Some make it when they get medical attention, some don't. Given that even our medical system in the US would struggle with such a high volume of patients if this were happening here, you can imagine what a skeleton medical crew in Gaza is going through with limited to no supplies as a result of Israel's genocidal siege and blockade. So, how do they do it? How does the medical personnel in Gaza find the strength and internal fortitude to serve in such an inferno? There's only one possible motivation behind the heroism we're seeing among the medical staff operating in Gaza. And this is the deep rooted belief that to save a single life is to save the whole world. Dr. Altalla lives by this surah. A teaching assistant at the Faculty of Medicine at Al-Azhar University in Cairo and a medical director of Al-Amal Health Center, Dr. Altalla wakes up every day to manage the critical task as a surgeon for the surgery department of Al-Aqsa Hospital. Dr. Altalla had the misfortune of witnessing one of the worst surges of patients as a result of the Al-Nasr massacre on June 8th, which resulted in 270 plus murdered and over 700 severely injured. We interviewed him on June 19th, where he relayed the nightmare of the surge, but multiple other ones have happened since then. A week ago, Dr. Altalla and I were scheduled to do another recording, but right before that recording, there was another massacre at Al-Mawasi, Khan Yunis, where 141 Palestinians were murdered, at least, by this piece of shit cowardly regime, and 400 were injured. Dr. Altalla had to treat many of those injured, as there are not many doctors in Gaza left. Dr. Altalla, how are you doing? How's your state of mind right now?
Yeah, I cannot describe it. Really, I can't describe it because everything is surrounding. It's very bad. Even in Al-Aqsa Hospital or in Nasser Hospital, we cannot imagine what is happening now. So I have a different thought and a very bad thought that we don't know what will happen in the next few days and what will happen in the next few minutes. So everything is around is very bad. So we try to do our best and we try to survive as much as we can and we try to help as much as we can. So the general situation here in Gaza is very bad.
Tell me what's happened in the last week. The last week alone.
Okay,
Describe what you've been doing.
start by the last news that occurred today. Today, a thousand of family were forced to evacuate and to leave their home and tents from the east of Khan Yunis, which is a city at the south of Gaza. So, massacre occurred this morning in area called Khan Yunis. More than 50 martyrs and more than 100 of injured victims reached Nasser Hospital. So every few days there is a massacre occur in any area in the south or the north of Gaza. Also, at the beginning of this month, the European Gaza Hospital, which lies in the south of Gaza, an area between Khan Yunis and Rafah, they enforced the medical staff and the patient to evacuate from Gaza, from European Gaza Hospital, which is another functioning hospital. So now it's out of function. They enforced more than 400 patients to evacuate from the hospital, and now the hospital is out of function as there is no medical supplies or no medical machine to use it in managing the victims there. So now the only functioning hospital with all its capacity is Al-Aqsa Hospital. Nasser Hospital tried 1 month or more than 1 month ago to return to be functioning, and it's now functioning by limited resources and limited capacity. So now the only functioning hospital in all Gaza Strip is Al-Aqsa Hospital. And a massacre occurred in the safe area that the Israeli army tell people to go to this area. It's Mawasi Khan Yunis. A massacre
Yeah.
occurred about 2 weeks ago in Mawasi Khan Yunis, and more 100 martyrs at massacre and more than 800 injured victim at that time. So there is no safe area in all the strip, even in the south, even in Nasif and Nimes, even in the north. All of us are in danger in your home, in your tent, in the street, in the hospital, in the shelter, in every area. And yesterday, quadcopter planes uh, but try to target my shelter, the shelter that I'm volunteering in it inside the medical bike. Yesterday at the night, they target the shelter by bombs and by guns. So there was one monkeys and more than 10 victim, injured victim. So this is the situation. And 2 days ago and 3 days ago, there's a towers in area called the Nusayrat. Uh, they try to target it one day, each day. They target more than two towers, and they destroy it completely. So every day and every moment, we see the destruction, we see the massacre, we see uh, the bad moments. So this is a brief of what is occurring in the last few days and last few moments here in Gaza.
How close were you to the latest strike on the refugee camp that you were serving at?
Yeah. I was close, but something that occurred 4 days ago. They, you heard me, yeah.
Yeah, I hear you.
Okay, 4 days ago they target a building near us. It's far from here, about 50 meters. It's about Al-Maghrib. It's about the starting of the dark, and they target this building, and every person here at this area enforced to leave his home or his tent. Okay, and after that they said they will target a mosque. The mosque is near my building. It's just there is 1 meter, that 1 meter separated from my building, and it was dark, and I just at that time returned from the hospital, and I'm so tired, and I'm suffering from fatigue. So I yeah hello hello
I'm here.
yeah Mark. What?
Yeah, I
Can
hear
you
you.
hear me?
What were you? I hear you. What were you saying?
Yeah, okay. I will resume my speech. Okay.
Yeah.
Okay, 4 days ago, they target a building. It's far from here, about 50 meters, at the beginning of the night. And after a few minutes, they said that they will target a mosque. The mosque is close, very close to me. There is just 1 meter between us, and we don't know what we should do. And I at that time I just returned from the hospital, so I packed my bag, and we ran in the street in the dark, and we don't know where we should go. So you can imagine, if you can live in this nightmare and bad moment, that if they will say to you, we will target your neighbor building or your neighbor mosque, and you will not know what you should do at that time. You will have children, you will have your certificate, you will have your devices. You don't know what is the most important thing that you should pick up with you, and you from which side you should run. So really, we are suffering. And really, we are too exhausted, and I don't know how can I express my my feeling. Yeah.
How's your sleep? Are you getting enough sleep?
No, 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 no. Every day I just sleep about 4 to 5 hours in each day. So you can imagine I'm really exhausted. So I got used of that. Really, I got used of that.
Doctor, I want to talk about the Al-Mawasi massacre. Can you tell me what that was like for you with patients last Saturday?
Okay. At that day I was at the shelter at the morning. I have a shift at the medical point in the refugee shelter, and about 11 a.m. Al-Aqsa Hospital, the surgical team, called me to come to the Al-Aqsa Hospital, and quickly I go to the hospital, and I don't know what is happening at that time. So Nasser Hospital at that time is out of service because it's overcrowded and overwhelmed by injured victims. More than 100 martyrs and more than 800 injured victims. So they try to refer some of these cases to the neighbor hospitals, and we got some of these victims, and we tried to manage them. So at that time, the situation was very bad and so horrible that the Israeli army target the safe area that they claim it's a safe area, and they target it in the morning, and at that time, 11 o'clock, it will be so crowded, and uh, airstrike that target another tower in Nusayrat area. I'm not far from Nusayrat. It's about 3 kilometers or less to be in Nusayrat. They target another tower in Nusayrat Towers area.
What was it like handling those patients on that Saturday at Al-Mawasi? From Al-Mawasi, the Al-Mawasi massacre.
You can hear how loud the drones are now. Okay, I will talk about the patient. The majority of patients at that time, and in every time, and in every massacre, it's about the majority of them are from women and children. Yeah, and we face that the majority of victims in these days and in this war are suffering from burn and from amputation in their limbs. And according to the burn, it's high grade and high degree. It's about from third degree and more, third and fourth degree, and it cover a large body surface area. And we cannot see this burn before. I don't know why this occur. It's from the gun or from the bombs that they are used in their airstrike or what. So I think they use a special type of bombs in their airstrike here in Gaza. And majority also of patients are suffering from amputation in their limbs, even if the upper limbs or lower limbs. You can see a young man with he was lost all for limbs.
Doctor, I want to talk about medical supplies.
Medical supplies. Okay, okay. Uh, 2 days ago, Al-Aqsa Hospital, the medical director of Al-Aqsa Hospital announced that there is a shortage in the medical supply, and this will affect the operation. Most affected part from this shortage in medical supply, the operating room and the emergency room. So we try to use as little as much we can for this medical supply to save the rest of this supply for another victims, as the crossing now, all the crossing to Gaza is closed now, especially the Rafah crossing. So really we are suffering from shortage in medical supply, and we try to do our best to save this medical supply. And there is a few medical supply for one use. We try to use them again. So we try to save as much as we can to for another patient, as the all hospitals in Gaza are suffering from shortage in medical supply, as no allowed to enter Gaza, and even the nutritional aid. So the medical aid and the nutritional aid are not allowed to enter Gaza from Egypt or from any country. So there's a
S-
shortage in these medical supply.
So how are you handling it? How are you managing without these medical supplies? How are you dealing with the shortage? What is the medical staff using to compensate?
I said about the medical supplies. We try to save medical supply as much as we can. For example, in a case of bleeding in the emergency room, you should use a lot of gauze to help you to stop this bleeding. But at this moment, we use the amount of gauze that the little amount of gauze that should help us to stop this bleeding. So we try to save life, but in limited resources, and we and sometimes we succeeded in that, and sometimes we cannot handle that. So in another example, if there is a minor surgery, we can do it without anesthesia, and we can just use a small amount of analgesia, which is a painkiller. Yeah, 3 days ago, there is a boy, 13 years old, who has a complete elbow fracture, who need transplantation. So his dressing is underwent under general anesthesia. Okay, because it's a very painful process.
Can you tell me about the blood supply? Does
No,
Al-Aqsa have any blood supplies?
no, for more than 2 months ago, there is no medical supply allowed to into Gaza. So Al-Aqsa Hospital tried to save as much as, yeah, as it can to from this medical supply, and they are using the medical supply from their storage. So there is no medical aids into Gaza for more than 2 months ago. So all hospitals try to use the storage amount of this medical supply in their storage.
What about the medical equipment? How is the medical equipment? Which equipment is still operating? Which devices are operating and which devices are no longer operating and no longer usable?
According the medical equipment, there's some subspecialty try to use an old equipment that we don't use this equipment in the modern time. So, for example, there is a neurosurgeon in Al-Aqsa Hospital use equipment that not used in all countries and in all worlds at this time, but he tried to use that to save a life. There is a neurosurgeon in Al-Aqsa Hospital tried to use an old machine which not used in all the worlds at this time, because it's an old machine, but he tried to use that to save a life. So you can imagine that there's a shortage in this equipment, and we in the surgical department try to compensate this deficiency by trying to use what we can and what we find. And there's a few mission in Al-Aqsa Hospital. There is a two mission, medical mission. They try to bring with them some of these equipment, but it's not. We cannot. But it's not too large amount. It's just little and a few amount of this equipment, and some of this equipment, not all equipment.
What does your medical support staff look like? You cut out again. Can you start over? I'm sorry for this connection. I'm sorry.
Okay, okay. According the medical staff that are in the support or in the mission before 2 months ago, they are all related to emergency kits and emergency staff, and some of this we can use that in the operating room. So all of them focus on operating and emergency stuff, like fluids, like gauze, like wires, like some equipment for surgeon, and like stoma for patient who underwent a colostomy or ileostomy. So all of these stuff related to the emergency situation.
Doctor, let's talk about the death toll. There's recent reports came out that the death. No, you look good. It looks good. It looks fine. Um, I want to talk about the death toll before I lose you. I hear you. I want to talk about the death toll real quick. The Western reports are now saying the death toll is over 186,000. 86,000 martyrs. 186,000 martyrs.
Yeah, I think now, as I said before, the Ministry of Health announced about the cases that reached the hospital, and I think there's the same number that they don't reach the hospital. So I think this war will finish about will be more than 100,000 deaths or martyrs. So not all cases reach the hospitals to be recorded in the Ministry of Health list. So the number is too little for what is occurred now in Gaza.
Habibi, how many cases of malnutrition are you seeing?
Oh, every day I see for more 3 cases in the medical point at the refugee shelter. So last few days I started a project of malnutrition in the age group of 5 years to 12 years. So I just recorded in one day for more than 40 cases that are suffering from moderate malnutrition and 2 cases suffering from severe malnutrition. So every case I see for more 3 cases in the age group less than 5 years. All people and all age group here in Gaza are suffering from malnutrition, but we cannot do anything for these cases, and we try to do our best to manage them. Personally, I miss about 17 kilogram of my weight. I was about 82 kilogram before the war, and now I am 65 kilogram. So you can imagine every person.
Let's talk about dehydration. The dehydration rates amongst your
Okay,
patients.
about you heard me, yeah?
Yeah, but you cut out at the last minute. The last minute you cut out.
Okay, I just started a new project that concerned about malnutrition in the age group between 5 years and 12 years, and I recorded many cases in just one days, and about 2 cases that are suffering from severe malnutrition. So the severe malnutrition, we refer them to the hospital, and every person here in Gaza are suffering from malnutrition. Personally, I miss about 17 kilogram. I was about 82 kilogram before the war, and now I'm 65. So every person here are suffering from malnutrition.
What about dehydration among your patients?
Every day, I manage about 130 cases in the medical point at refugee shelter. And there is about 10% of these cases are suffering from gastroenteritis, which is related to the dehydration. So a lot of them are dehydration, and just one person suffering from severe dehydration, which is need a hospital admission. So the dehydration is really concerned and really common nowadays because many cases are suffering so bad water. So it's not too clear this water because about 3 days ago the Ministry of Health 3 days ago that announced that they find out that there is a polio virus in the water inside Gaza. So if polio virus uh, target any person here in Gaza, it will be a pandemic because there is a shortage in vaccine at the south and at the north of Gaza. So it will be a big disaster. It will be a catastrophic. Polio virus will cause a large problem for people here in Gaza. The Israeli army announced that they started a vaccination for their soldiers here in Gaza. And children here in Gaza are suffering from a shortage in this vaccine of polio. So we expect that we will find any cases in the next few days, and it will be a big disaster for the Ministry of Health here in Gaza. It will be a pandemic. So it will be a big problem if we find out any cases of polio virus here in Gaza. We we cannot deal and we cannot handle that. We cannot deal by the injured victim. So we will not we cannot control the situation if the polio virus will spread between people here in Gaza, as there is a shortage in vaccination at these days. You hear me? Yeah.
I got you back. Now you're back. Doc, I want to ask you about I want to ask you about diseases. What is the most common disease that you see spreading?
Okay. All of them are infectious disease and acute gastroenteritis, as there is a poor hygiene and the water is not too clear. All of this, it's related to the genocide. And a few days ago, we imagined that there is cases of blood diarrhea, which all related to the poor hygiene and poor sanitation, and the sewage water are mixed with the drinking water, and the hepatitis A virus. And we expect in the Ministry of Health and in the medical point in all Gaza Strip that we may find out a case of polio virus in the next few days, as we discover that there is a polio virus in the water inside Gaza Strip. So this is the almost all diseases that occur here in Gaza, and there is we observe that there is increase in the dermatological disease like scabies and like impetigo, which is a bacterial infection uh, that affect the skin of the young. So it will cause a rash, and this rash will spread between young children. So all of these diseases now are related to the genocide and to the poor hygiene and the poor sanitation level here in Gaza nowadays.
You're back.
Yes, brother.
So I want to go back to the support staff. What does your support staff look like? The medical support staff.
Yeah. According the staff and according the I should start about the team. Yeah, there is a shortage in the team of the emergency room and in the surgical team. As in each shift, we just only about 5 doctors in the surgical department and few doctors in the emergency room, and they cannot handle uh, how amount the large of the injured victim and the martyrs. And according the staff, yeah, and according the equipment, there is a shortage in this equipment, and we try to do our best to find out another things that we can use instead of the original stuff. So there is a shortage in this stuff.
Yeah. So what are you doing to handle the shortage? Are people volunteering? People who have no medical experience, are they volunteering?
Okay, okay. Personally, as I'm a teaching assistant at Al-Azhar University in Gaza, yeah, I resume the training of my student in Al-Aqsa Hospital. The fourth and the sixth level of the medical student faculty of medicine, they are have a training every day in Al-Aqsa Hospital in the surgical department. I teach them theoretical and practical skills every day. So they are trying to have a responsibility in the surgical department and in the emergency room, and they have a large effort, a big effort to manage victim. So I we try to compensate the shortage of the medical staff by having a volunteers, having a medical student. We try to teach them every day the skills that they need to manage and to deal with the victims in the emergency room and in the surgical department. We really we have benefit from uh, those medical students, and I'm proud of them. Really, I'm so proud of them. They get out from their homes and tents and danger to train and to manage victims. And I have in my profile at an Instagram picture with my student in the first days of their training. They are training now for 2 months ago, and they will enter the third month of training. And after the training, they will volunteer in the emergency room and in the surgical department. So I'm really proud of them.
And Dr. Atalla, we're proud of you. We're proud of
Yeah,
you. Okay?
thank, thank thanks,
You have a lot of love
thanks,
going
my
your
brother.
way. Okay? You're a hero.
Yeah, thanks a lot. That's why I'm trying to do my best and I'm trying to keep going in the hospital and in the medical point, in the street, and everywhere. That's why I have a good and a positive energy from your words and from your support. Really, your support push me in front and push me in front of lines at any place. So thanks a lot.
What's giving you hope right now? What's giving you the most hope? What's giving anybody hope in Gaza? Where are you finding your hope?
The hope insert in my heart when I succeed to save a life. I feel that I'm so proud of myself when I save a life. And when I see the smile in the face of a patient or a victims inside the hospital. So that's why I'm trying to smile even in this bad moment. And my hope also, I got my hope from your support and from your really great words. Really, your support push me, and this is my hope. And I hope everything will be okay soon. And I hope that the war will end soon. And I hope this genocide will finish. And I hope that I will start my master degree next September. And I hope to get the master next September. I hope. So this is my hope.
Doc, you have a beautiful smile. You have the most beautiful smile, brother. Your smile, it's your smile is healing. Is the most beautiful smile.
Thanks a lot, my brother.
It
Yeah, you make me laugh, and I
glad you
love
heard
that.
that.
Thanks a lot.
Hey, Doc, tell me some of the positive moments you've had.
Yeah, okay. 4 days ago, while I was in the medical point in the refugee shelter, a mom presented with only 14 days old baby. She presented this baby to me at the medical point. The baby was suffering from respiratory distress. Uh, I did as much as I can to save his life, and I called the ambulance to save his life. This mom miss about, I think, two of his children in this genocide, and I tried to save the life of this baby. And I referred this baby to the hospital urgently by the ambulance, and the pediatric the neonatal ICU, intensive care unit. They did their best to save his life, but they also referred them to the European Gaza Hospital. The European Gaza Hospital is out of function. Then the patient was referred to the Nasser Hospital, to the intensive care unit, as there is a empty bed in the ICU, and they saved his life. So I then call my friend who is a doctor in the Nasser Hospital, and I got got the news that the baby life is saved and he's okay now, and he can their mother his mother can bring some of clothes to get him discharged. And I called the mom to come to my medical point, and I told her that's a great news. You can go now to the Nasser Hospital and you can bring your baby now. He's a god, but you should take some of clothes to your baby. And she has a very good energy that his baby is okay now and he's alive now. So I'm so proud of this moment. Really, till this day,
Mashallah.
I call her and I bring her to the clinic to reassure that the baby is okay and he's okay now. When he come to me, he has a respiratory distress with a convulsion and something severe, convulsion with respiratory distress, and he start to be see a nose bluish discoloration in his lips and in his face. So I did my best to save his life after she has missed two children in this genocide. So I did a good work. This is the
Yeah, you
last,
did.
yeah, this is the last things that I'm proud of this month.
Be proud. Be proud. Habibi. Be
Thanks,
proud.
brother. Thanks.
Alhamdulillah. Um, I have, uh, I speak with a lot of Palestinians who live in Palestine, and a lot of them have their prayers directed at you. I have a Palestinian friend wanted me to give you a surah, Surah 33,
33, just a minute, I will check which Surah Al-Ahzab.
Al-Ahzab.
Yes, Surah Al-Ahzab. Yes. Yeah, there is a ayah I love this ayah from this surah. Bismillahir Rahmanir Rahim. من المؤمنين رجال صدقوا ما عاهدوا الله عليه فمنهم من قضى نحبه ومنهم من ينتظر وما بدلوا تبديلا. I love this ayah from this surah
Why?
because it's really describe what is occurring now. Because the God that choose some of us to be in another life, and also there's the rest of people like me is waiting his is waiting what will occur in the next few days or in the next few weeks, if we will be martyrs or if we will still alive. So we don't know what will occur. So I think this surah and I think this ayah is describing what's occurred now.
Iowa. Uh, well, I
No
wanted to
one,
give you this.
yeah, no one now in Gaza have the guarantee to be still alive. You anyone hurt can be killed at any time or and at any place. So
Yes.
we
Well,
waiting our qadar and we waiting what will occur. in the next days.
Well, Doc, awakum Allah, hafidikum Allah, nasara kum Allah, ayadekum Allah.
I think the God choose the best for every person here. So we have a hope that everything that is occurring now is the best for you. Even
I
if you
hope.
be killed or if you be injured or if you miss your home or if you miss your job or if you miss your family. So everything is occur now is the best for you. All of my family, alhamdulillah, is okay.
Alhamdulillah.
But I miss some of my friends. Really, I miss. I miss.
Who do you miss the most?
He's a doctor. He's my colleague in another university. He's a doctor, and I miss him. He stay in the north of Gaza. I miss him about 6 months ago. At the January, he was killed in uh, in an airstrike in the street. He has a dream, and he has his own life.
Can you tell me more about him? What kind of person was he?
He's a doctor, and he's older than me by 1 year, and he just graduated at my year because he delayed to enter the university. And at January, I was in Rafah because we are forced to evacuate from our home at that time. And I know this bad news from the internet that he was killed in an airstrike in the street, and I got shocked. At that time, I was sit with a group of people, and I go to an empty room, and I cried. I cried too much. My eyes was too red, and tears uh, in all my face. I cannot. I cannot believe this bad news at that time because he's my friend and I love him too much. He has a dream to be a surgeon or to be a pediatrician. He's a good friend and I miss him too much. I just wait the moment till they will allow to the people to go to the north to visit him in his qabr. And I promise to do a good action for him, to do sadaqah, to do zikr, to do Quran. I will try to keep his name up and to keep his story up. His first name, his first name is
Okay.
Muhammad.
Well, Doc, Allah knows you miss him. He's in Jannah.
Till now, I remember our God moments. Till now. And every night I try to do zikr and Quran for him. And at last Ramadan, I did complete Quran, قراءة Quran for him.
Yeah.
Yeah,
Doc,
yes,
I know you
brother.
know this, but Allah Allah is watching over your soul. Allah has your soul in his hands. Okay?
Okay.
Your soul is right here in Allah's hand. You know that?
Yeah, the best thing that I think he's now in Jannah.
Wallahi. He's in Jannah.
That's right.
He's in Jannah.
That's right.
His soul is with Allah. Allah has his soul in his arms, in his hand.
Yes, brother.
Yeah. Yeah.
Yeah.
Muhammad, I want you to know something.
What?
You don't have to be strong. You don't have to be strong with me. Save that for your patience. With me, you don't have to be strong. You understand? Okay?
Okay,
You don't have
brother.
to be strong with me. That's for your patience. With me, you don't have to be strong. You know
I
that?
got use of that. That's why I'm trying to be strong. I got use of that.
But you don't have but you don't have to be strong for me.
That's right.
You don't have to be strong for me. Your patients need that strength, not me. Okay?
That's right. Lottie, I try to express my feeling when there is a suitable situation and suitable moments to express my feeling. And I think it's a good opportunity to express my feeling with you, my friend. I think, yeah, we should have another speech, and I will express my feeling and I will express what I'm thinking about it because you need to, when you express your feeling, you will be comfortable. I,
You're
I,
back.
I,
You're back.
yeah, I'm back, but the dark is began now, and
Okay.
the drone sound is too loud because I'm in the roof, and
Yeah.
I think it's too dangerous. I think I should.
Okay. Yeah, Doc, take care of
I should
yourself.
go.
Barak Allah Fik.
Okay, if you have a last question, I think you can go, and I will answer it, and I will go after that.
Uh, okay, my last question is about the Quran. I want to talk about the Quran. Okay? Tell tell me what surah you've been reading lately and what has been
Yeah, you
keeping
can go.
your strength up. Tell me what surah you've been reading in your head and thinking about in your head lately. Yeah, what surah are you thinking about? Ah, shit. Goddamn. Fucking internet.
Yes, what's your question, brother?
My question is about the Quran.
Yes.
I want to ask you what surah have you been reading lately? And what surah has been on your mind and in your heart in the past few
Yeah,
weeks?
okay. I will talk about the most uh, favorite surah to my heart, and I will talk about also the most closest surah at this time to my heart. The most favorite surah for my heart is Surah Yusuf because I love the story of uh, our Prophet Yusuf. Okay, and the most closest surah nowadays to my heart is Surah Al-Nasr because I'm sure that, and also I'm confident that we will have the Nasr. I'm confident that even if we have 1,200 victims, the destruction in Gaza, but we will have Nasr at the end of this genocide and at the end of this war.
Thank you, Doc. Any other surahs you want to talk about that have given you strength?
We try to every day. I try to hear surah of Quran. Every day I try to hear a different surah. So every day I have a different surah to keep my mind on and to insert the hope in my heart. So I love all the Quran. And the most surah that I heard currently is Surah Yusuf.
Beautiful. Thank you, Doc. Doc, I know it's getting late for you right now and it's getting
Yes,
more
brother.
dangerous. So I want you to know we love you. Okay. We'll sign off right now because I know it's getting late for you and more dangerous. So I want you to know we love you. We support you. You are a giant in my eyes, and you're an inspiration to all medical doctors worldwide who are watching this. And with that, I'll say Barak Allah Fik, Habibi, my brother. Make a fist.
Yeah.
Now punch it.
Yeah.
Right here, pound it. Right at the camera. Okay.
Yes, brother.
Hey, Doc, get some good sleep, okay? And protect yourself. May Allah be with you.
Yes, brother.
Boom. Got it. I got it. We got it.
Thanks a lot, my brother. I'm glad to meet you. See
You
later.
too. Barak Allah Fik. May Allah be with you. Salam alaikum. Pray for that guy. God bless his soul.
إذا جاء نصر الله والفتح ورأيت الناس يدخلون في دين الله أفواجا فسبح بحمد ربك واستغفره إنه كان توابا